The perfect equation to help end the COVID-19 pandemic includes mass testing and mass vaccinations, but both have slowed down in Nebraska.
From our peak in November, we were getting about 20,000 tests per day, and we've had about an average of 7,500 tests completed daily for about the last month.
The state's contract with Test Nebraska is up in July, and the state isn't sure if they'll extend it.
I'm assuming it's going to turn into more of like, hey, I'm going into clinic, hospital, name wherever you go, and I don't feel good. Okay, we're going to do, a COVID test. We'll do a flu test. And that's what it'll end up turning into.
But as the vaccination effort progresses, some are steering away from testing completely, thinking that after a vaccine, you'll just get false positives. This is false, and we got a hold of the state's leading infectious disease experts to explain.
No, I think that's one of those urban myths. The vaccine really will not make your test turn positive.
You can and should test positive for antibodies, but not the actual infection just from the vaccine.
Vaccine just boosts your immune system. There's no live virus to cause positive tests.
Much of the state has, in fact, been vaccinated. 56% of Nebraskans have received at least one dose, and almost 43% are fully vaccinated. But the numbers have plateaued, and state officials want those numbers to jump to at least 70%.
We're doing a lot of outreach to businesses. We're trying to get into the communities. We're trying to change our hours. Make it walk-in versus scheduled appointments.
To stomp out the virus, both testing and vaccinations need to be synchronously working together to avoid outbreaks from variants. Outbreaks like the devastating conditions we're seeing in India now. Hospitals full, out of oxygen, out of room, and out of staff.
If infection goes out of control in other countries and there's different variants that emerge, then we're at risk all over again.
A lesson to remain vigilant. Reporting in Omaha, Rudolph Sinaida, 3 News Now.